So, how important is physical therapy when it comes to surgical conditions, post surgical conditions? I will tell you, it is extremely, extremely important. And unfortunately, I love the medical world that I work in. That's why I'm in this position. That's why I'm in this field. But unfortunately, the medical community has gotten very I'll say it's changed a lot in the last couple of decades. And unfortunately, the medical community is not so much focused on what the patient needs all the time or providing the best options for them. And I see that firsthand all the time. And it kind of saddens me as a physical therapist because it pretty much kind of demotes our profession as to the importance of and value of what we do as physical therapists. And I see this so frequently. And I just had two patients just this past week where they had surgery, whether it's on their shoulder or something else. And the doctor either says you don't need therapy or says, just go to the therapist one time and have them give you some exercises. So that just happened recently with a patient who had a shoulder surgery. Any shoulder surgery is going to really require a decent amount of rehab. There's just a lot involved with getting the mobility back, especially when they've been in a sling for 4 weeks, sometimes 6 weeks. They're not moving their arm. They don't have the strength. They don't have the mobility of it. And as much as anybody can be really, really good self-disciplined, it's still not going to be the same as somebody working on it, somebody supervising them, somebody guiding them. So the order from the doctor, unfortunately, was to come in for physical therapy for one visit, be given a home exercise program, and go on and good luck. And when I spoke to the patient, and this has happened several times, unfortunately, and when I tell people, when they have this prescription, I tell them, listen, our job as physical therapists is to evaluate and treat the patient and try to help them improve their function. And there's a lot of functional improvements that need to take place after a shoulder surgery. So me as a therapist, I do not even give out home exercises usually on the first day unless I know that it's something that's really going to be beneficial that the patient can handle. The reason I don't do that is because I believe that there needs to be supervision and there needs to be a guidance on these exercises that people are doing at home. So if they come in for the evaluation, we're doing a little bit of treatment, but a lot of it's evaluating what the issue is. We get into full treatment the next session they're here. So if I just hand out 15 or even five exercises to somebody to work on at home, and we haven't gone over them, and I haven't seen how they've done as a result of that, they could go home, they could do them wrong, they can have more pain, they could have more problems, their form can be all off. So if I'm not supervising them in here in the visit and seeing how they're doing with things and modifying and adjusting as necessary based on each individual, then I'm not really doing them any justice. So for me personally, I don't give out exercise on the first day, and that's why. I want to go through the exercise with them. I want to make sure that they're doing them appropriately and make sure that the outcomes are what they're looking for and I'm looking for. So in a case where a surgeon is telling a patient to go to therapy, have them give you a whole bunch of exercise and go on your own, I'm sorry, but that is just not a good plan. And I don't know how that's going to help the patient in the long run. So if that is a situation you're dealing with, I highly advise you to contact a physical therapist, talk to them about coming in, being evaluated and treated, and let the physical therapist determine what the physical therapy needs are. Unfortunately, I'm not a surgeon and I wouldn't give anybody recommendations on how to do surgery. And I wish that physicians would understand what we do and the value we have in the medical community and allow us to do our part in the whole rehab and process for the patient to get better. So please just be advised to what's out there and what's being offered, and just know that physical therapy is not just, here, take these exercises and go home and good luck. It should be some supervision, it should be some modification, and it should be some guidance on how to get you through your whole process on it.